right, thanks Oyeyemi. And like you said, seated already with us in the studio is Dr. Christopher Otabo, consultant, orthopedic surgeon, and medical director, Alliance Hospital, Abuja. We welcome you to the program.
Good morning. Thank you for having me.
Yenre?
All right, we have joining us in our Lagos studio, Frank Moneme, the Executive Secretary, Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria. Frank is a pharmacist with specialization in market access, a consummate advocate for local pharmaceutical manufacturing and medicine security in Nigeria and Africa. Many thanks for joining us, Frank Moneme.
Having me.
All right, we also have joining us via Zoom from India, Professor Martin Emeje, the Director General, Nigeria Natural Medicine Development Agency. Thank you, Prof, for joining us all the way.
Thank you. It's a pleasure to be here and privileged to be on this program, NTA. You are number one.
All right, so we kickstart our conversation, this morning, and just because we have the consultant orthopedic surgeon with us right here in the studio, we'll just start with you, and so we just want to hear from you first and foremost. You deal with a lot of patients with different ailments, and I'm sure you know what the current prices of medication is at the moment. So I want you to tell us, is it that Nigerians are just complaining, or is it really true that prices have gone up, and what is the position at the moment?
Thank you once again for having me. The reality is staring everybody in the face. We can't run away from it. What we're experiencing right now is actually stagflation. It's more than inflation, and the misery index is hitting the roof. By that we mean when you combine unemployment with astronomical inflation. And in the last 6 months, we've seen inflation like never before in the history of this country, at least since I was born about 50 years ago. We haven't seen anything like this. And I think the two factors responsible are, one, the removal of fuel subsidy, and two, the floating of the naira. Those two major policy of the current government has resulted in astronomical inflation. And it's not like maybe prices multiplied by 2 or 3. That would even be good. Sometimes you could have prices increasing by as many as 5, 6, 7 times. Something that you were buying for 2,000 naira before, the next time you are ordering for it, you are getting it at 10,000 naira. So it's crazy. So, and the population, the people will bear the brunt, because and a lot of companies are folding up. Many hospitals are closing down. Many manufacturing companies are leaving the country. I learned of Glasgow Smith Climb that's left, and by those companies closing up, they are throwing more people into the unemployment market in the presence of inflation that is not going down. So if you hear people complain, they are not complaining for nothing. It is the reality, and these are translated into a lot of people dying. Yes, yeah, because to a large extent, people's salaries have not increased. If at all they increase, maybe by just a marginal level that is not in any way commensurate with what the inflation figures are saying. So, I mean, people's dispensable income are still the same. They cannot afford basic medications. So many of them resort to other forms of unorthodox methods of healthcare. They go for prayer houses. They go to traditional healers. They know that these are not the best, but what would they do? Since they don't have the money to buy the orthodox medication. So at the end of the day, we're in a quagmire, and something definitely needs to be done.
All right, thank you very much, Dr. Tabo, for your opening salvo. Let's go to Lagos, where Frank Muoneme is seated. He is Executive Secretary, Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria. Frank, Dr. Tabo, like many others, has linked, the issue of Nigeria's dependence on imports. In this area, talking about, again, the exit of some pharmaceutical companies. Do you think this is enough to shoot up the price of, or the prices of medical essentials?
Thank you once again for having me. And I'm excited that we're having this conversation again. I was here 2019. And in 2019, and we had this conversation about medicine security. The challenge is that it's not just only pharmaceuticals. Everything that had to do with products, services, they are all being affected. This is hugely because of the negative microeconomic dynamics as alluded by the doctor in the studio. And so it's not just peculiar about healthcare or medicals, but generally it affects, even in my own home, it affects the budget I make for my wife to take care of my household, basics is no more the same. She also complains, and so it generally affects everything that concerns us. So, but the good news is that the local farmer has been very resilient. Interestingly, like you mentioned, we are so much exposed to imported medicines. But the good news, like I said, is if you look deep, you discover that if you compare imported medicines to locally manufactured, and you notice that we are not that exposed compared to totally imported medicines. And that is part of what we've been clamoring. I've mentioned this before in this studio, that the Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria conceptualized what we call medicine security concept. Today, medicine security turns out to be the buzzword, but the truth is that it was conceptualized by the Pharmaceutical Manufacturers Group to bring the attention of policy makers, leaders, to see how do we de-risk our exposure to issues like this, peradventure in situation that we find ourselves. And I recall this, I made the presentation at National Council on Health, National Council on Industrial Investment, 2019-2020. And the emphasis was, how do we de-risk ourselves so that peradventure we'll find ourselves in this situation, so that we'll have what I call pharmaceutical independence, or be independent. And in a very simple way, the argument on medicine security is about, except you on the driver's seat on how the medicines, the consumables you're using is produced, except you exert sufficient input on how they are being produced, access to safe, quality, affordable medicines will continue to be a mirage. If you watch, I mentioned affordable medicines. This is one of the elements that the concept was able to capture, and that says that the only way you can become affordable, the only way you can be able to guarantee quality, the only way you can be able to, hedge the prices, the skyrocketing prices, is that when you are in control of the medicines you produce. And this stands to, from end-to-end manufacturing, from the API to finished pharmaceutical product, to last mile delivery to the pharmacies. So what is their contribution? What input are you bringing into the table? So if you are not on the driver's seat of these elements, then there is high chances that where we find ourselves today will keep repeating itself, because even in COVID-19, where lessons were learned, and during the time of COVID-19, there was a lot of priority on the pharmaceutical manufacturing. But then, post-COVID-19, there's complacency, because I can tell you there was a lot of lip services. So there are so many barriers, and very key and very essential is the aspect of forex, access to forex, access to forex. Yes, as you are aware, most of the APIs we bring them into the country, and so what that means is you need forex to be able to get these products. And if you are not able to access this forex, so you go to the open market and get this forex, it all affects everything. It all affects everything. But beyond the aspect of foreign exchange, you also look at how do we look at policy convergence. There's a lot of policies that are not annexed. Most times, those, if you look at message security, you're looking at regulation, you're looking at research and development, you're looking at supply chain aspect of it, and then you're looking at having a vibrant and robust value chain in pharmaceutical manufacturing. And then the question you ask yourself is, most times you see policies that are, counterproductive. You see even agencies, government agencies that should also play the role of regulation, because either they are not well funded, and you see also sometimes they cross the boundary to become revenue drivers. You see government agencies that, for instance, like Nigerian Customs Service, where there is a policy of the government that puts things in black and white from fiscal policy perspective, and then you just say, the government says, VAT, you don't pay VAT for pharmaceutical raw materials, and you get your goods into the country, and you're struggling. The customs say you're going to pay VAT, and then you look at, this is not what the policy says. The policy says that inputs into pharmaceutical products are exempted, and then the man over there in the policy is saying, no, you're not going to carry your good. Mind you, you have a production cycle, you have a target to achieve. In the cycle of all this, what happens is that there is a demurrage. And I am coming to Abuja to go to the headquarters of customs to clear things that are written black and white by the government. And by the time you get back, so the manufacturer will look at it and say, what, I'm losing so much, what do? I just have to pay, I just have to carry my consignment, because the goal is, if you're not in business, you're not in business. The only reason why you mentioned that companies are leaving is, if you're not profitable, if you're not making profitable, if you're not profitable, you will leave. So, but for pharmaceutical manufacturing companies, local companies, we have nowhere to go. We are here. We've put up investment, huge investments. This is our place. So there's nothing we can do about it. But we are the one that are holding forth, and being emphatic about it, because there's nowhere we can go. This is our country. We are the only one that can harness our resources, or the only one that can put our investment to close this gap and the rising prices in medicines. Over to you.
Monime, you have actually mentioned a number of issues, but key amongst them is the fact that importation is the main factor driving the increase in prices of pharmaceutical essentials. And that will take me to Professor Martin Emeje. You are the DG of the Nigerian Natural Medicine Development Agency. From what we've been able to establish on the program, of course, things may be a lot better, if manufacturing of these pharmaceuticals are done in Nigeria, and of course, sourcing the materials locally too, that would help. And from research and from different papers we've seen in the past, it shows that Nigeria has some of these, materials that are required, or if you like, ingredients, to formulate some of these pharmaceuticals. So what exactly are the what are the problems or what are the factors limiting local manufacturing of some of these pharmaceuticals in the country?
Okay, thank you very much, NTA, again for inviting me. I want to thank Frank in the Lagos studio for at least saying some truth. But please, I want to beg that anytime, I think we should start doing something in our country. Anytime anybody, whether you are public or private sector manager, anybody who is appearing in public to say anything in this country should first of all take an oath that if you lie or you say something for selfish reasons without taking national development into consideration, you should die. We should start taking oaths before we speak to the public. Having said that, let me say this, and I have been saying it before I became Director General. Our problem in Nigeria is not whether there is price increase of anything or not. Prices will increase. Prices are not increasing only in Nigeria, right? And it's not only drugs that the prices are increasing. If prices of things are increasing, but you are the one making those things, will you have problem? You will not have problem. We are not making anything. That's why we are complaining of an increase in prices. And government has already established research institutes. And if you go to all our research institutes, including mine, you will see a lot of prototype products that have been developed. I went to National Assembly during interaction with the Senate Committee on Science and Technology with my minister, Chief Uche Naji. We all went there. I showed them the products that we have at NNMDA, the Nigerian Natural Medicine Development Agency, waiting for entrepreneurs, waiting for even our own pharmaceutical industries in Nigeria to come and take them and manufacture them so that it will be available for our people. Are they doing it? Are they ready? I've been Director General for 6 months now, and I have been talking to all the pharmaceutical industries in Nigeria. Only one, Evans Baruch, has visited the agency. I spoke with even Frank that is seated there now. I spoke with him. We talked at length. So the problem is we like buying and selling an easy, quick profit too much in Nigeria. We don't consider our nation's security. We lack national pride. We lack national pride and patriotism. Yes, I am in India. I'm on the field. As you can see, you see people moving at my back. I am on the field in the farms where Indians are making their own medicines. Then they make it and then they send it to Nigeria. And then we come back and we are complaining. See, all these prices we are complaining about, is it not the prices of drugs for the elites that we are complaining about? The people from the villages, do they buy the drugs we are talking about? If you go to the general hospitals in the 774 local governments in Nigeria, our general hospitals, the drugs that we are complaining are costly. Are they there in those general? They are not there. So the drugs for the poor are not even available. Let's not even talk about the cost. They are not even available. The imported drugs we are talking about is for the elites. Those of us living in Abuja, in Lagos, in Port Harcourt, the doctors, the pharmacies, the professors, the CP people, politicians, all of us who have access, who can buy these drugs, we are complaining that the prices are increasing. The men and women, the children, the youths in the village, over 100 million Nigerians who are in the villages and they depend on herbs. And their parents, they go to the bush, they cut those herbs and squeeze and drink. Or they go to traditional medical practitioners. Our traditional medical practitioners, they fill up everywhere in our villages. They are the people these people run to. They run to for their health, for their medical services, for their healthcare services. So when we were doing, when COVID-19 came, and it down on everybody that, look, you cannot leave your own country. Many, including governors in Nigeria, did they not traditional? The governor come on air and mention the plan that he used, and it became a problem. People started criticizing him. So we know what to do in Nigeria. Government has established also agencies to do these things. They are there. The private sector in Nigeria, let me tell you the truth. The private sector in Nigeria, the only thing they are interested in is business. How do I make my money? How do I make my... So that's why everybody is looking at importation of pharmaceuticals. The things we are importing, they are made from other countries. Why are we not making our own? And we have the skill. We have professors of chemistry, professors of pharmacy, we have medical doctors, field everywhere, who are shining all over the world, that they can do and make sure that we have our own medicines in Nigeria. We are not making because research and development is not a priority for us as a nation. We are here to decolonize our brain. We have been pauperized. We are suffering because we have refused to come out of our own colonialism. We are not the only country that was colonized. But many countries were colonized, but they have liberated themselves to begin to do things for themselves. So we must do things for ourselves. Okay, we just did budget defense now. Nigerian Natural Medicine Development Agency was given 399 million naira to do research in 2024. Is that how to develop? 399 million naira that some people are using to feed livestock is what a whole parastatal of government should use to do research and we think we'll make progress. That's why I ran here, because I have the privilege of studying here. That's why I ran here to come and seek support. Because more than, see, we are scientists, right? Immediately I became Director General. I and my team at NNMDA, we carried out a research on civil servants living at the Federal Secretariat in Abuja. Well, all the civil servants, they are listening to me now. They partook in the research we did, and they were very happy to be part of that research. We wanted to know from them, between allopathic medicine, please allow me to call it Oyibo medicine, between Oyibo medicine and our own medicines, from our traditional medical practitioners, from our own herbs in Nigeria, which one do they prefer? Which one are they assessing every day? 93% of the civil servants working in the Federal Secretariat, they say they prefer that one. Why? Because they know that their salary cannot buy at ACT. If you are unlucky to have a serious disease like cancer, is it your 30,000 naira you will use to buy anti-cancer drug? When one month anti-cancer supply, for example, for prostate is 500,000 naira, are you not going to die? Therefore, we must.
Let's hold it here. You've made a lot of points, but I'm thinking, let me stay with you. I'm thinking that it is not a question of whether they believe in our own. It's not a question of whether the people like our own. You have also said it, that they prefer our own. But one recurring issue has always been the question of dosage. How do you determine what an individual should take, how much an individual should take for this particular medication that is locally made from local herbs and all whatnot? How do you tackle the question of dosage?
Please, I have said it repeatedly on NTA. Do not be deceived by anybody or group of people who tell you that the problem of traditional medicine or herbal medicine or nutraceuticals in whatever form, I don't call them alternative or complementary. It is actually the imported ones that are alternative or complementary. That the problem is dosing. The problem is not dosing. We have passed the level of dosing. We have advanced beyond dosing. In fact, we even use nanotechnology in traditional medicine now. So we have passed that. How can you say dosing is a problem when we have intellectuals in all our research institutes and I'm telling you, please, NTA, please come to even my own agency, come and do a documentary. And I'm telling you, not just my agency. You know, I was a researcher at the National Institute for Pharmaceutical Research and Development, where we made the medicine for sickle cell, which May and Baker is marketing today. Is it not from traditional medicine? Does it not have those? So what are we talking about? Those is not an issue. No, people look for reasons for the country not to focus on development of our own things. That is the issue. So when you hear dosing, when you hear they are dirty, when you hear they are on the road everywhere, all those things are reasons. Don't we have those reasons also on the imported medicines? So why let us ban it now and say because fake and counterfeit drugs are everywhere in Nigeria, we don't need the imported drugs again? Okay, because people are manufacturing drugs without NAFDAC approval in some parts of Nigeria, we will no longer import it. Let's do it. So dosing is not a problem. That's what we are trained for. Please, if there is any traditional recipe that please, for emphasis, at the Nigerian Natural Medicine Development Agency, all the researchers from the DG, that is me, from the DG to the least researcher, we work in the lab. We stay in the lab. If you come to our agency in Lagos, in the morning, you cannot see us in the offices. We all work in the lab. So please, give us a traditional medicine that we cannot put it in the proper dosage form. If we cannot do it, then all of us will resign. If you don't sack us, we will resign.
Professor Martin Emeje, I like the way you are, speaking about this issue. And I think that's the way Nigerians must begin to look at issues that affect us as a people. Dr. Christopher, I'd like to come to you because you made a point earlier by saying that the fact that prices of drugs have gone up, people are dying, and of course, yes, people are at risk. We're talking about lives here, not just lives of grown men, we're talking also of lives of children. But Professor Martin Emeje has said that people who live in rural areas do not take these branded drugs or drugs that come from outside the country, and they seem to be doing fine. And there's also another school of thought that the reason why local medicines have not thrived in this country is because doctors like you don't prescribe them, even when you know that they can, take care, they're efficacious, they can take care of a particular ailment. You prefer to go for those ones that you know that when they buy from your pharmacy, you make more profit. Like Professor Emeje said, we're talking, doctors are in the business, or if you like, people who are in the pharmaceutical industry are in the business of making profit. So you would not want to recommend the agbo or the ginger and the garlic that will cure an ailment because the person will go to the market and buy it and nothing comes to you. So why are doctors not also thinking of recommending, local, pharmaceutical, products that are available in the country?
Thank you for the question. I think the professor is trying to oversimplify a complex problem. To start with, it is not true that the people in the rural areas don't depend on the services of those of us who practice in urban areas. There's usually a drift, a flux that he doesn't recognize. He doesn't understand the referral system. When someone in the rural area develops appendicitis, for instance, the local health practitioner will try. When it's not working, they refer to the local government headquarters. When it's not working, they have to move to a specialist hospital, and from there they end up in the teaching hospital.
But you know that the number is very minimal compared to the number of people that live in the rural areas.
Not minimal. That is the trend. The only thing is that the reverse is not the case. But with the referral system in the country, people move from the rural areas and they gradually move until they get to the most sophisticated. I still see patients from the deepest local government areas in this country. We still see them in the government hospitals like the Asokoro General Hospital, Maitama and Wuse and all that. Or more than half of the patients who are on admission, they traveled from several kilometers from their rural areas to come. You can't be talking of traditional medicine when you are with due respect, I know that traditional medicine works, but you raise a question about standardization. You can't be talking of, things that have not been tested and trusted when you are talking about critical care, for instance. Now, the problem with our traditional medicine, he's making it look like we have surmounted all the problem. The only problem now is that doctors are not embracing it. We are trained minds, we are scientists. We work with evidence. How many papers have they presented at international community? Because the medical profession is a body of knowledge. I, as a surgeon here, I speak the same language as an orthopedic surgeon in the US. I attend American Academy of Orthopedic Surgeons conference, and we make presentations. When I say something, it reverberates around the world because there's a body of knowledge and there's a minimum standard. You can't stay in your small corner and be glorifying what you have done and you have not subjected it to international scrutiny. Lives are too sacred. We cannot, someone is in the ICU, probably has an open heart surgery or has an abdominal surgery. You want me to take your local concoctions to give to the patient when we don't know what it is? What the challenge I'm putting across to the professor is, please bring out your publications, not just in your local, in international journals about this. In fact, the world is waiting for him. If he brings out these things and it is tested with multi-center studies, not only are we going to use those products here, countries abroad will use it. Now, he's making it look like it's only Nigeria that import drugs. Even the United States of America, they import medications. If you go and shop in the US, many of the things that you are seeing in the US market, they are from China and other countries. So it's not, big countries have comparative cost advantage in terms of production. So they produce what other people need. And it's important. It's not a crime to import medication. I support local manufacturing, but it will take another 100 years. We will not be able to produce 50% of what we need to consume locally. So it's not we versus them. And it is not as simple as he's saying it. It's not like, oh, the rural people are the good guys because they consume local herbs, while the township people we have appetite. Who wants to be taking medications? Who wants? But people want to get well, and they want to be sure that when they go to a place, they know what they are doing.
But Doctor, I would like to find out from you. You talked about the fact that if Professor Meje has, some of these, medicines that he feels are locally produced that can do, some of the work that the imported ones are doing, then he should subject them to international scrutiny. My question is, there's this thought going around that the international community would not want, certain discoveries to come from countries like Nigeria. Is that true? Because, during COVID, for example, I remember that some people came out to say, well, we have this that could cure COVID. But, they find a way to shut them down just so that their market will continue to thrive. Do you think that conspiracy is on?
Yeah, I agree with you that there are some shady things that goes on, underground in some politics. But to an extent, if you have done studies locally and you have evidence that this thing is working, this standardization is standardization. Even NAFDAC is waiting to approve some of these things that they are talking about. Don't we have NAFDAC? How many of those products have NAFDAC certified to say this is a world-class antibiotics? Please drop your levofloxacin that you are importing. Come be using this one. I mean, the field is there for them to play. But he just mentions a few medications for pain, for this and that. But we're talking about critical pharmaceutical consumables.
But can't we start from somewhere?
Exactly.
No, it's good to start from somewhere, but we are not there yet. For now, there is a gap that needs to be filled. And the only way we can stay going is to import these medications, and it is expensive to import. It's just like saying, why don't we do local refining of petrol? I mean, that we know that that's the standard thing to do. But for now, there are issues about that. And for now, if we don't import petrol, everybody will be grounded. That's what it is now. And we must face the fact. But instead of blaming the doctors and the clinicians as the ones who have refused to embrace local medication, go and standardize your medication, subject it through trials. NAFDAC is there. And then let us see whether we will not embrace it. We will.
All right. Thank you very much, Dr. Tabo. Let's head right back to Lagos, where Frank Moneme has been waiting as well. Frank, I'm sure you have listened to both Dr. Tabo and Professor Meje on Zoom. My question to you is, you, luckily, lead a group that belongs to the Manufacturing Association of Nigeria. Where do we go from here? Because the idea is to be able to produce affordable medications and medical essentials that Nigerians can easily pay for and use and stay alive instead of resorting to anything they can lay their hands on or perhaps just die.
Can you hear me? Okay, thank you so much. You see, I just want to, I was in November, I was invited as a speaker at the world local production that has to emphasis of the word is how do you drive local production? How do you drive to increase local production? And my topic was more of how do you overcome the barriers to financing local production so that they will become affordable, accessible, and to the locals. And I just want to, recap the kind of submission I made at Hague, and I want to make the same submission. Just like what every other person is saying, if you look at what all the submissions resonate on what I call political capital to solve problems. Political capital to harness the potentials of the scientists as mentioned and the research as mentioned by Professor Eneje. The political capital to understand that the local farmer should be prioritized, to overcome those barriers that make us not competitive. What are those barriers? The political capital to be able to close the gap in infrastructural deficit. The political capital to be able to create a special forex regime for the pharmaceutical manufacturing companies so that those ones that they cannot, the value chain that you must have to bring into the country, you'll be able to solve them. The political capital to optimize the existing policies of government that are done in black and white that says you don't pay for VAT for pharmaceutical raw materials, inputs, the value chain, the packaging materials. The political capital to influence the machineries that we don't produce here, as we are bringing them into the country, there should be an expedited action by way of, duty waiver, by way of zero tariff for those machineries. The political capital to understand there is an interface between fiscal policy, monetary policy, regulatory policy, and the elephant in the room is how do you have a robust pharmaceutical manufacturing company, life science companies to produce the essential things that we need. The political capital to understand that our research and development institutes must be funded, they must be strengthened, the same to fund our regulatory institutions so that they will move away from focusing on the revenue drive, but regulatory. So in all, the key answer to this is the political capital to drive existing and also improve, come up with new, innovative, forward-thinking ways on solving these problems. And I am excited because the industry, we've engaged the coordinating minister of health, Professor Ali Pate, such a man that is very knowledgeable and have a wide reach, from the global perspective. So for him, I mean, there is a commitment already in that direction of that political way, but then we want to see it, in execution. We want to see it, to the later to be able to close these gaps. For instance, some of these products that some of these companies that left Nigeria, the local farmer, I'm aware, like about 11 companies do have beta-lactam facilities, meaning that if they are supported from regulatory, research perspective, then they can ramp up and scale up to produce those ones that will have capacity to manufacture locally. And what that means is that there should be expedited action to assess forex to be able to close those gaps as we speak. But this is a short-term goal. But the long-term goal is that local farmer, the research aspect of it, should be seen from, most times when you talk about local pharmaceutical manufacturing, the question that the policymakers or they ask is, what percentage of GDP are you bringing to the table? We should start looking at the local farmer from perspective of what percentage of GDP you're bringing to the table. The local farmer should be seen from perspective the way that the armed forces are being supported to do their duty, because when the chips are down, like we find ourselves like in COVID-19, we are the one who will be here. We're not going anywhere. We are the one who will close the gap in access to medicine. We are the one that will look inwards and convert what we have to be able to close that gap. Just like Professor Eme just said, we are also the one that will also take off the research that in our chairs from our research institutes, partner with them to also, commercialize these products. But then, the elephant in the room is political capital.
Loud and clear. But you see, it is one thing to provide these waivers and political capital, as you have, built an umbrella for it. But it is another thing for those of you in business, in pharmaceutical business, to be able to make some sacrifice when you begin to get all of these waivers, to curb your appetite for huge profits. Because even if you get all the waivers and you still want to make folds of the hundreds and 200s of profit, we still will be on the same spot. Are you willing to also make some sacrifices?
The question there, talking about if the manufacturers themselves are willing to make sacrifices. I'll get to Prof now, who's in India. Professor Emeja, you had you had Dr. Christopher earlier when he also pointed accusing fingers, at your agency and other agencies that are saddled with the responsibility of carrying out research, bringing out products that are locally made, and of course efficacious too, Prof. So I'd like to ask, outside you telling us that your staff or your team are in the laboratories, the products that you have researched on that you have found to be efficacious, what have you done? What steps have you taken to get them out, to get them certified, if not by the international community, by NAFTA and all of that? And also, what are you doing in terms of promoting these products so that, those who use them can be aware and also, want to patronize them?
Before I answer that question, I said that we are bedeviled by some kind of mentality of we can't do it on our own. We have to wait on those that have taught us. And I'm not surprised really, because I mean, for 60 years, we have been taught the things but that are mostly not relevant to us, because our educational system is imported, and it has remained an imported educational system. Let me say this. Yes, if what I said, the doctor in the house said that that I make it look very simple. It is actually very simple. We are the ones that complicate issues for ourselves because we don't understand them. And I am offering to send this doctor free of charge, without government money, to India or China to go and learn traditional medicine. So please, let's not be talking about publications here. If it is publication, I discuss publication. So it's not publications that develop countries. I mean, as I'm sure that as a medical doctor, he saw COVID-19 vaccine. What was the publication that gave out COVID-19 vaccine? So please, because there's no time usually on this platform, I want to invite this doctor for sponsorship by those that know what traditional medicine is, which are the people we work with, to go to their country just for 2 weeks and come back if it will remain the same. Then let me also say this in order to be fair to professionals in medicine, that's medical doctors, pharmacists, and nurses, who are working with the Nigerian Natural Medicine Development Agency. Because we have so many medical doctors, pharmacists, and nurses, and medical lab scientists who are working with us. Now, having said that, I would like to let you know, that my agency has 5 products that have been given approval by NAFDAC. 5. So, and we are a government research institution. The responsibility of putting this product to the market, what we call commercial production, is of the pharmaceutical industry. Okay, so we have done our own. All the industries are aware of what I'm saying. NAFDAC is aware of what I'm saying. We have said it. National Assembly is aware. Okay, so the responsibility is that of the pharmaceutical industry, and we will continue to discuss with them. By the way, it's one of the things that I'm discussing with some international agencies here. When I was working at NIPRID, the sickle cell medicine from our own traditional medicine, when all Nigerian companies and many medical doctors, because not all of them, were criticizing it, an international agency. So it's a lot of things to discuss, but to answer your question directly, we must all agree, whether, no matter your profession. In fact, I did not accuse any professional. It's the medical doctor that is feeling guilty that I was accusing fingers on doctors. I'm working with medical doctors, so why will I be accusing medical doctors? Okay, but those that don't know, they don't know. But you will need to know, and you have to humble yourself. I became a professor before I started studying traditional medicine in China and India. You must be humble to do that. Okay, if we can never develop our own traditional medicine if doctors are against it. Luckily, we have many of them that are not against it. The current Minister of State for Education is a medical doctor, Dr. Sununu, and he's supporting traditional medicine very well. So there are many medical doctors that are supporting it, and we are coming out. Let us stop saying that we must have international approval. What international approval? The traditional medicine that my people are taking in the village, which international approval are they using? And when you talk about people coming from the rural areas to the hospital, the referral system, I'm a Western trained, I know it very well. How many people are referred? And those that are being referred, if you don't have somebody in your family that can take care of your bills, will they refer you from to Abuja, and the government will treat you free? Even ordinary card of 10 naira, will they attend to you if you don't buy that card? It's those that have members that can take care of their they refer them to town and they work. So please, I'm pleading, all the doctors like you, please join hands with us, because it is medical doctors who were trained in the Western way in order, that supported development of traditional medicine in their own country. You know why? Because they are interested in this medicine security of the country. They have pride about their country. They are patriotic. It's not about business or feeling big, that I have gone to school, I am a doctor, I'm a pharmacist, and when I talk, you must listen to me. There are many things that traditional medicine people can do, and you can never do it as a medical doctor. Yeah, and I can tell you that because I know. Okay, so please, that is a plea. I am not here to argue with any medical doctor. I have a responsibility right now, and I'm going to do it, and you will see the difference. And I've
All right, many thanks, Professor Omejo. Of course, we want to see a difference in the health sector, and that's why we're talking about, this topic, talking about pharmaceutical essentials. It's very important.
All right, you're welcome back. This is still Good Morning Nigeria, and we've been discussing affording pharmaceutical essentials. Now, earlier we had tried to reach Frank in Lagos, and I'm told he's right back. So Frank, I was asking earlier, yes, you've talked about the need to get waivers. Let's hope the authorities are listening, and then you get the waivers, you get all the support that you need. Is your groups like yours in the Manufacturers Association of Nigeria, able to make some sacrifice, to reduce the cost of medication? Because even if you get all the waivers in the world and you want to make maximum profits in folds, in multiple folds, then we'll still be where we are. Are you willing to make some sacrifice? What are you bringing to the table?
Thank you. I just have to make you understand that before now I've been saying that anybody setting up a facility to manufacture in Nigeria is a patriot. Patriot is a legacy project. It's not that profitable. How will you be profitable when 20 to 30% of your energy cost of production, cost of production goes to energy? 30 to 40%, according to man. You're not profitable. You're just holding forth, because when you look back, the investment you put up is unimaginable. You can't abandon it. Just yesterday, we are having a meeting with the DG NAFDAC. One of the CEOs, the member companies, said first quarter, the second quarter, he brought in a container of active pharmaceutical ingredients, and that was at the cost of 100 million. By the time we're about to get to second quarter, he wants to, order another one for his suppliers, and the cost is now 170 million. Are you still there? The cost is 170 million. So, how profitable could you be? And then, I recall he said that when they told him that the cost of bringing in the active pharmaceutical ingredients is 170 million, he summoned the management meeting and put the cards before the table, and everybody told him, sir, the ball is on your court. Should we be manufacturing to be profitable, or are we manufacturing to be at loss? And he looked at all of them and he said, yes, the ball is on my table. For the nation, Nigeria first, will bring it in at 170 million. Mind you, this is just only the API. We're not talking about the bureaucracy of clearing these goods at the port. We're not talking about the energy cost. We're not talking about the manpower. Of course, the salaries of people that are working in the pharma, they are still the same, even with hyperinflation. Nobody has increased the cost of the professionals. So in all this, the prices are still the same. So what am I saying? The local farmer, we've done it before. In the time of COVID-19, there was a lot of profiteering amongst those I call, traders. There was a lot of profiteering, but the local farmer, who came together and advised ourselves that this is a national calling. And I remember we had a lot of series of meetings with the Minister of Industry, Trade and Investment and Health, and they set up what they call a emergency operation committee under the Presidential Tax Fund, which I was a member of the committee representing the PMG man. And there was, a lot of, directives from government to fast track expedited action on, products that are very essential. Because in the lockdown, people were like, how do we sustain those that are on non-communicable diseases, anti-hypertensive drugs, anti-diabetic drugs, anti-malaria? How do we continue to be producing in the lockdown? And we agreed that we have to do all we have to do to make sure that Nigerians still have access to medicines. And then we are bridging the gap to make sure that there's no profiteering amongst us. And it's still the same, because Nigerians are price sensitive. Yes, other multinationals can increase their prices. You can see everybody saying things. Most of those products are elitist perspective. Most of them are elitist perspective. Why will I go and be buying augmenting when there is alternative that is manufactured local that can do the same thing, generic? So, I am advocating what presently we are doing with some states. Most states, Sokoto, Kaduna, Niger, Nasarawa, Ekiti, we are partnering with them. The state government, since 2021, we partner with them to lock down more like supply chain, meaning there's organized, supply chain in those states, whereby we because there's a kind of pool procurement, the prices, because they are buying volume, there's a coordinated supply chain, the prices, we are affordable. And I am saying that if government should prioritize those products that are essential medicines that evidence suggests that will have capacity to manufacture locally, these products, there should be a kind of support in the forex regime, and of course, there should also be expedited action in the port clearance at the port gateways, even the regulator. So there should be a kind of a task force, within Federal Ministry of Industry, Trade and Investment, Federal Ministry of Health, Nigerian Customs Service, Industry, Trade and Investment, and we sit down and look at these things, on the short term, and see how we can fast track, production of these life-saving products. I think with this strategy, we'll be able to manage the impact of the inflation on these medicines.
Point, Frank, and I'm glad you have gone in that direction. Of course, that's my line of thought at this point. We have mentioned the issues, Dr. Christopher Otabo. There are so many issues. And, as a doctor, your duty is to save lives. I'm sure you're not happy about the fact that your patients can no longer afford, drugs, and a lot of people are losing their lives. Some people are resorting to other ways to help themselves instead of, coming to you as a doctor to save them. So, looking at it now as a Nigerian first, as a doctor trained to save lives, and again looking at it from the point of view of an average Nigerian who cannot afford, the costs of drugs at the moment, what are the ways you think we can solve this problem? While we were on break, you mentioned, trying to get, the research organizations or the institutions in the country that are to look into drugs. Instead of looking at traditional medicine, they could actually get international standards as regards some medications and then produce them here locally. That way the price could come down and all of that. What other measures can we take just so that we can save the lives of Nigerians?
Thank you very much. Let me backtrack a little to say that we are not actually against traditional medicine, like the professor tried to, his body language is suggesting. We've used some traditional, locally made Nigerian medications. Like, for instance, the drugs that is being used to treat sickle cell disease, manufactured in Nigeria, discovered in Nigeria, manufactured in Nigeria, and we are using them because they have gone through the necessary scrutiny. When you come to me and you say, I am sick, doctor, treat me, that's a huge responsibility. And we don't take it lightly. And whatever we prescribe is also being, it will be subject to evaluation should there be a problem. If I prescribe something to you and something happens to you, the patients have the right to drag me to the Medical and Dental Council. And I must justify every single prescription. So it's not a fight. The call is that please raise your standards. So we are part of the international community. When I say we need to subject our products to international community, Nigeria is a part of the international community. There's a Nigerian Army General or Major who discovered a product, and they are using that product all over the world today. He contributed his body of knowledge to the international community. He was not just grandstanding. He went through the process, did studies, and it was accepted worldwide. And his name is written in gold. We are looking for people who will come out to discover product and subject it to scrutiny. Once it has gained international recognition or even national recognition, we will be using those products. Coming to how to reduce price, it's easy. The gentleman, the guy from Lagos already began to say things in that direction. The local production of what has already been discovered, that's the easiest way out, because you cut off a lot of, when you import pharmaceutical products from India, for instance, first of all, the people who produce the drugs, you're already giving jobs to India instead of giving jobs to Nigeria. The cost of customs and so many things. So it's not profitable for us to import drugs from India, even if, because we need to differentiate local production of medication from traditional medication. Local production of standardized medication, like the one that is used globally. If I go to the US and I say I want to buy paracetamol, they give me paracetamol. If I go to India, I want to buy paracetamol, they give me paracetamol. If I go to West Indies, it's the same thing. That is already standardized. But we have to still import paracetamol from India. That is the problem. And that's why it's expensive. We can have the manufacturing plants in Nigeria to be producing the paracetamol. All we probably need is to import the API that he talked about, the active pharmaceutical ingredients. That would cut down the price. But from what he said, from what the gentleman in Lagos said, they are also having their own demons to fight. There are a lot of problems to overcome. The customs, the regulatory agencies who are running the track of the manufacturers, and so on and so forth. We need to take out all those bottlenecks so that it becomes easier for them to import the active ingredients, manufacture here, give job to people, and still get the product come out at a reduced price.
Talking about, getting the products come out at a reduced price outside manufacturing, and I know that government has tried, by coming up with this National Health Insurance Act. In your view, has that helped? And what are the challenges, with that?
The National Health Insurance Act is still at the babyhood stage, in my opinion, in Nigeria. The coverage is hopelessly low. We're still talking about less than 8% coverage. So if we have 200 million people, we are talking of less than 20 million people being covered by NHIS.
And not all ailments are also covered.
That's even one. The number of people covered is one. Then now come down to the number of ailments covered. By the time you are getting really seriously ill, NHIS is behind you. It's no longer behind you. So we need to increase the number of coverage as well as the scope of coverage, so that and then many private hospitals are running away from NHIS because the what is payable in terms of tariff is not okay. Look at the problem now. In the last 6 months, prices of drugs have increased by 3-4 times on the average, and yet NHIS has not moved a muscle in terms of increasing what they will pay to hospitals for those same drugs. And I don't blame them too much, because salaries have not increased. Because the salaries, you made deductions from salary, certain percentage. So at the end of the day, we are all in a quagmire. We need the government, from the presidency to the Ministry of Health to the Minister of Industries, and everybody will need to come on the table if we love the suffering masses, and because those are the lower rung of the ladder, they are the ones that suffer it the most, because they are the ones that are more vulnerable. They are the ones that are likely to die from preventable causes, because they cannot afford 10,000 naira, 20,000 naira to take care of themselves when they fall ill.
But now that the Senate, through its local content committee, is working to foster collaborations which can speed up Nigeria's efforts at producing medical supplies and alternative medicines, how do you think this can be coordinated to achieve the best of results?
You know, there are too many things about Nigeria that is so sweet on paper. But when it comes to implementation, you just find that we just fall flat on our faces. That's the problem. What we need is a pragmatic leadership. Leadership who would think of something and follow through. Many of the projects and programs that are mentioned on the pages of newspaper and in TV houses, they just want to score political points. And sometimes some of the people are just looking at what will come to them. They are really not interested in the deliverables from the program. So if they can follow through this and actually devote their energy to it, and devote and make budgetary provisions for it, it will go a long way to reducing some of the problems.
All right, thank you, Dr. Otabo. Professor Emeje, I'm sure you're still with us right there via Zoom. You've heard Dr. Otabo talk about some things that we can do. For you, being the DG of the Nigerian Natural Medicine Development Agency, and of course you have affiliations with other agencies that are also saddled with the same responsibility as your own agency. What's the way forward? At this point, what are you calling for? What would you want government to do, those in the industry, and even Nigerians, so we can come out of this quagmire?
Okay, thank you. And because you will soon stop this program, let me itemize my way forward. And I start my way forward by first thanking the doctor for at least agreeing that all of us need to come together. Number two, for also realizing that traditional medicine is different from pharmaceutical product development. And for mentioning the drug for sickle cell, the professor that you are seeing was the responsible for getting that sickle cell drug up there. But as I'm talking to you, doctors are not prescribing it. Then, number three, we should do this. Let us agree in Nigeria that, look, since for now we cannot agree that there will be integration, because most of the medical practitioners don't understand that traditional medicine is cultural. There is nothing about go and prove it in US that the treatment you are giving in my village at should be the same treatment in the US. There's nothing like that. We will need to government. This is government owner. Government will need to agree that, look, let us have prioritized development of traditional medicine so that we can begin immediately documentation of what the traditional medical practitioners are doing, their services, their products that they are rendering, and then those of us who have gone to school and we know where these things are advanced in other countries can apply science and technology to make it in a form that it is more durable and more accessible and safe for our people. That's one. Number two, we must prioritize also research and development as a nation. If you look at our budgetary allocation, it simply shows that research and development into health research and development is not a priority. Number four, the private sector, all philanthropists in Nigeria who donate huge sums of money to political campaigns and to weddings and obituaries and burials. Please let them begin to donate money to research institutions, to create foundation and fund research and development. Then they will have first right of refusal when products come, so that they will ensure that products come out, it comes out, and the return of investment is also good. Number 5, all of us as Nigerians, please, nobody should be intimidated by anybody who has gone to school and is not telling us that traditional medicine is bad. It is not bad. It is the spirit of colonialism that is making us think that our own is not good. We must wake up to develop our own things ourselves, because if we leave it to the big pharma industries in other parts of the world, they will not, because right now we are a huge market for them and they don't want that market to go away. And if you develop your own in-house in your country, the markets will go away. Finally, NAFDAC has more than 200 products that are registered. They are called listed. That means NAFDAC has given a stamp to say that these products are safe to be used. Doctor in the studio, go and start using those products that NAFDAC has given approval. Stop waiting for America to give validation before you use it. Thank you. Over.
Okay, thank you, Professor Meji. So just your last thoughts, Frank, just before we round off, in 30 seconds, what's we know you already mentioned some ways we can solve this problem. Just on a final note now.
Okay, thank you. On a final note, I just want to say that a lot is so much dependent on political capital to do the right things, to follow through what is already existing, and to also think innovatively on how to, do things. For us in the industry, we are innovating, even with the challenges. Some member companies are investing in manufacturing API. And as a matter of fact, most times people say, oh, Nigeria don't manufacture anything, API. You are aware that even India, that is the pharmacy capital of the world, depend on China for their API. About almost 60%, they bring it from China. But post-COVID-19, there is a political capital influence from the president that never again will we totally depend on importing API from China. That we need to evolve and be self-reliant on manufacturing our API. And that is...
Frank, I think that's a good place to leave the conversation. We need to be self-reliant. We need to look inwards. And I'm sure that all those who are critical stakeholders in this matter are listening. And of course, there'll be a way forward. By the way, the budget for 2024, 1.33 trillion naira has been budgeted for health. That's about 5% of the entire budget. Let's just hope that all this translates to something good and, of course, to protect the health of Nigerians. Many thanks once again for joining us, Dr. Christopher Otabo. Because of time, of course, we'd have loved to take some of your insights on some of these issues. Consultant orthopedic surgeon and medical director, Alliance Hospital, Abuja. Good to have you once again.
Thank you for having me.
Thank you. Also, Frank Amwaneme, Executive Secretary, Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria. Thank you for being our guest again from 2019 and 2023. You're here with us again. We hope when next to call on you, you will be available. Thank you. And we hope to see change and improvement as far as manufacturing is concerned. Continue to be patriotic, like you said. Professor Martin Emeje, Director General, Nigeria Natural Medicine Development Agency, thank you for your time. And we hope when you get back into the country, we begin to see, more steps taken by your agency and other agencies so we can solve the problem on our hands. So that's the topic, discussion on the topic. We have something?
Yeah. Next is sports.
Super Eagles and Napoli striker